Thanks for staying with us. March 14th is World Kidney Day, and it is a day set aside to raise awareness of the importance of our kidneys. While kidney disease can affect people of all ages and races, women tend to face more specific challenges linked to kidney disease. The risk of developing chronic kidney disease, CKD, is at least at a high in women as it is men, and maybe even higher. Now, joining us on the show is a consultant physician, nephrologist, kidney specialist, and head of dialysis at the Federal Medical Center, Ibutimeta, Dr. Nmadu Danladi. Welcome to the show. You're head of this kidney center? Oh my goodness. I would think you just left secondary school. I'm just joking. You look very young and, you know, somebody in that level.
Thank you.
Good to have you on the show.
Oh, thank you. I'm really, really excited to be here. Mariah, Miriam, Nima, Obi, I'm a fan. I'm so happy to be here. Happy International Women's Day in areas, and happy Mother's Day in areas as well.
Thank you.
Oh, yes.
So, would you like me to call you Dr. Danladi?
No, Dan is fine.
Dan is fine. Okay. So, Dr. Dan, every year we discuss kidney, but sometimes forget to remind ourselves how it affects women, especially now that we're talking about International Women's Month. Could you give us an idea what kidney disease looks like and why is it more prevalent these days in women? Okay,
I think it's just more awareness. I think people are more enlightened and they know a little more.
Yeah.
Kidney disease usually, if I could start by just saying what the kidney does. So what the kidney does is like it removes waste from the body. And so when your kidneys are not working, this waste tends to accumulate in the body and tends to cause a few issues. So usually some people start to vomit, some people become really sick. And that waste, the kidney takes it out as urine. So if you're not producing urine, you can understand that your legs will start to swell, your face will start to swell. Sometimes it accumulates in the chest, difficulty breathing. The other thing the kidney does, I say the kidney is like a Nigerian. The kidney has a side hustle apart from moving waste. The kidney helps the body to make blood. So if you don't have, your kidneys are not working well, the person's blood level starts to fall down. The kidney also helps with bones. Finally, the kidney controls blood pressure. So people with kidney disease, their blood pressure tends to go up. For women, it's particularly important, especially with pregnancy, because once women are getting pregnant, they're close to getting pregnant, it's important to know your kidney status. If you get pregnant and you have severe kidney damage, the chance of you having premature delivery is about 90%. Whoa. Chance of preeclampsia, which is hypertension and kidney damage, is about 50%. Chance of you getting permanent kidney damage or worsening of your kidney damage is also about 50%. So my prof in school would tell me, you have two kidneys. Two kidneys are meant for women because it has a lot of, pregnancy has a profound effect on the kidneys. So it's important that everybody, women especially, know about their kidneys, and especially around pregnancy because it puts a lot of strain on the kidneys.
Is there some, okay, go ahead.
You just mentioned kidney status. Is there a particular test to know? You know, the way we do other tests to know of your kidney status?
Okay, so like I said, okay, so if you visit a general doctor, usually this can be done. We said the kidney removes waste. So the simple test we do is we just check your waste level. So if we check, there's this particular waste we call creatinine. Forget the technicality, but there's a waste level we check. So if your kidney is not working, it's a blood test. It's a blood test. So they just take your blood, and if the level in your blood is high, it means your kidney is not removing it. Whoa. So it should be in a particular range, and if it's low, it means your kidneys are overworking. That's also a problem. Wow. So it's supposed to be in a specific range. And the other thing is, you remember what the kidney filters is blood. So we also need to check your urine. I tell my patients, the way to know your kidney function at home is just to look at your urine. So if you wake up and you are peeing and there's a lot of foam, or your urine there's blood in your urine, or you're having difficulty urine, so just pay attention to your urine is another way to see. And then usually when you go to a hospital, we'll check your urine as well. And the final test we do is we take a picture of the kidney to see how they look. So we check your blood, check your urine, and we take a picture of the kidney.
With a scan?
Yes, it's called an ultrasound scan. So we expect the kidney to look a certain way, and it should be a certain size. And usually we want to be sure that there is no blockage in the path which urine uses to come out. And that's also something that tends to happen in men, but we're not talking about men now.
For women, now, how do you maintain your kidney health? So I know that there are people who are born with some certain, probably is hereditary, where they have some kidney issues, or they have high blood pressure, you know, mommy had it, daddy had it, and every child just picks up from there. How do you now maintain kidney health, especially if you come from such a family?
Yes, I think that's an excellent question. That's debated of me. Hypertension is the most common cause of kidney disease in Nigeria. A lot of work has been done around that. So if you know you have this risk, you need to control your blood pressure. So most of the patients I see in the hospital who are very sick, their kidneys are damaged, they just didn't control your blood pressure. The simple things to do if you know you come from that background is manage your salt intake. And also you need to regulate how much protein you take, especially because when a lot of the waste that the kidney generates is from protein. So usually you want to be careful with proteins and then you want to reduce your salt intake. So if you know you have a background of hypertension, you have a risk of hypertension, manage your salt intake. Finally, this goes for everyone. Just try to drink a lot of water. Whether it's hot, drink water. Usually any liquid will do, but preferably water. You don't want the complications that come in, so drink a lot of water.
Make sure you go to the bathroom often.
Yeah,
That's a good thing.
That's a good thing.
Okay, so Dr. Dan, so usually when I would hear, we would hear that, oh, a lot of women have kidney issues, and it's usually referred to because of our skin care routines and sort of things that we use. Is there any truth to that? Is it directly linked to some of the skincare products that we use?
Yes, especially those ones that are not approved. Some of those skincare products tend to have heavy metals and things that are toxic to the kidneys. And one of the things I used to illustrate is that the allocation, like I'm sure we've been talking a lot about federal allocation, the allocation of blood to the kidney is 20%. So you can understand that anything that ends up in your body would at some point end up in the kidney. So yes, with a lot of the bleaching creams, a lot of these complex creams that do all kinds of skin. So I would usually recommend, it should be NAFDAC approved, or at least it should be a Dermatology Association approved, because those things have toxins that may affect the kidneys as well. So if you're going to use a skincare product, just read the label. If it's doesn't have the necessary approvals, just be careful about it.
You talked about proteins earlier, and I was worried because part of my own diet is just, I eat not too much carbs. I mean, but I have more proteins and vegetables. So people in those it helps in weight loss, also reduce your carbs. How does that affect, will that affect my kidney in future, or I should be careful? Okay, so for you, if you don't have any background illness or your kidneys are just fine, I don't think it should be too much of a problem. Right. So yes, you can take your proteins, but usually, a large protein load is not usually recommended for your kidney. Protein. Yeah, so if you're taking, in Nigeria generally, we don't even eat enough protein. So I'm pretty sure you're not eating, I'm sure you're not having a full steak every other day. So you are probably not taking a lot of protein. But it's people who are eating one whole chicken and taking a lot of suya.
Yeah,
and all that.
I am.
That's the diet now. So initially we're not like that, but because of the diet, yes, we had to move more to protein.
Can I say, since we're talking about this diet, so a lot of people, this keto diet, actually, and we know that many doctors have an issue with that because they believe that you're taking too much protein. But what I understand about keto diet is that you take moderate amounts of protein.
Exactly.
Especially because it really came from America, where they would eat like a whole steak. But for a Nigerian, you're more likely to be eating moderate protein than an American who are used to eating. So just to put that out there.
Yes, I totally agree with that. So I guess our diet is deprived.
Yeah.
So I think...
Is the poverty thing it's costlier to buy chicken?
No, we just eat carbs more in this part of the world.
Yes.
So let's talk about the things we take in, because many of us live in communities where we inhale quite a lot of fumes, toxins and all that. How do these things affect our kidneys, or does it even affect it at all? Because there was a time a commissioner came on our show was talking about certain communities are very toxic in the kind of waste companies let out in those areas, and they're inhaling these things. So how does what we inhale affect our kidney?
So it's, I think it comes back to the allocations of the kidney. So literally, if you notice, most of the illnesses that affect kidneys, the top two will be hypertension and diabetes. So things that affect your general well-being will usually end up affecting your kidneys. So for inhalants, it's especially fumes and heavy metals, those things never really leave your system. They just go and sit down there, and then by that, they end up being toxic to your kidney. But in terms of, they're more toxic to your lungs, but it's more of a long-term effect that can affect your kidneys.
Interesting.
Some pills for those who are hypertensive. Some of these pills that they give them, don't they have some effect because I have someone that, has been hypertensive for a while. Perfect kidneys, I assume, because urine and passing physics is normal for the person, and there's so much pills that they get weak. What's possible connection can this, the tablets to control blood pressure be on a person?
Okay, so the all medications have side effects. And a lot of times when someone's blood pressure is not controlled, once you start to control it, the person's body has gotten used to receiving blood or working at that level. Once the person's blood pressure starts to come down, they start to feel weak. But the other possibility is that the person's blood pressure is coming too low. So that's another reason why patients that are on antihypertensive tend to feel weak. But other than that, all drugs have side effects. But antihypertensives, most of them, at least the ones that are on the market, are very safe. They've gone through several years of research. It takes about 10 to 15 years to get a drug from when it is made to all the research to say it is safe to use. So most of them are.
Now, can kidney issues be corrected?
Okay, so there are two types of kidney illnesses, and that's why our World Kidney Day is important, because we have what we call the acute kidney injury, and we have what we call the chronic kidney disease. With acute, it's usually reversible. So if someone has a kidney problem and we catch it early, we usually can reverse it. But usually if it lasts too long, then it causes CKD or chronic damage to the kidney, in which the kidney is damaged and then the kidney function never returns. So it's really important that people check and then they know these things so we can pick up these illnesses early, and so we catch them when we can really do something about it. Once the kidney is damaged, it is damaged.
Wow.
Yeah, so that's my next question would be, at what stage should you, or what age should you start checking to just make sure that your kidney is functioning properly?
So I think the risk usually gets higher from, and then there are different illnesses that cut across different age groups. So, but usually I think people should start getting more aware of their health. Usually once you get to 20, I think everybody should start becoming aware of their health. Usually since hypertension is the main culprit, usually that's around 40, but by 40 you should start knowing all your numbers. You should know your blood pressure, know your blood sugar, know all those things. But usually 40 for most, but 20, I think you start being aware. You should start knowing the things about your health, especially women.
From 20, by that time we don't have sense.
So there's a family right now, probably that a family member is trying to consider giving their kidney to a loved one, and family is worried about how would he function with one kidney. Could you give us an understanding, some kind of insight into a situation of somebody who has one kidney? Can they function effectively, and what are the consequences of offering your kidney to a friend who needs it?
Okay, so for patients who have permanent kidney damage, the treatment essentially would be you either do dialysis. If your kidney is severely damaged and literally gone, you either do dialysis permanently or you need to get a transplant. And what we advocate for is a transplant. Now, we don't even need for you to function, you don't even need up to half a kidney. So by the time someone is coming to the hospital and their kidneys are failing, it means both kidneys are totally gone. So you don't need up to even one kidney. So, and before we let you donate a kidney, we will check you. In fact, there was research that showed that people who donate kidneys live very long because it's the healthiest of the healthiest that we allow donate kidneys. So if you want to donate a kidney, there's a chance you might not be able to. If you had risk of you also having kidney disease, we won't let you donate a kidney. And then your heart has to be good. You have to be very healthy. So we'll screen you. And so if you qualify, you probably have more than enough kidney function.
And since you also mentioned that women, especially during pregnancy, there's certain load on the kidney, do you advise women to give kidneys?
So I usually, if you've not had your kids, I won't advise you to. There was if you don't mind, there's this popular story that was making the rounds when I was in training about a woman who had severe kidney damage, and then she came in she wanted to get pregnant. She came with her husband. And when she got there, we said, oh, your kidneys are really bad. You shouldn't get pregnant. And she was like, I want to do this. We gave them time. They agreed they were going to do it. And we told them, your kidney might get damaged. And the husband was like, I'm here for you. If anything happens, I will sort it out.
I'll give you my kidney.
And so she gets the baby. And then 6 months after, she developed kidneys. Her kidneys are fried. And she starts dialysis. And we called the husband, like, sir, you said you were going to sort this woman out. What's up? And the guy was like, so we gave him an idea of what it will cost. And then says, okay, give me 2 weeks. This is a popular story, actually, in nephrology circles. And 2 weeks, this guy shows up with the money, and he donated his kidney.
Okay.
But a year and a half after, guess what?
What?
Shows up pregnant again, and we're like, nah, you can't do this.
What? She got pregnant again?
Yes.
Is he okay?
Are they both
They
okay?
sworn to each other for life.
Okay.
They are in love.
So
They want to die together.
So the thing is,
And leave the children for who?
Telling you.
the other thing is, if you,
Trust.
it just shows how well you can also get when you get kidney transplant. That you can also get
That you
pregnant.
forget.
Yes, you can
Forget
get so
your
well. Yes. So kidney transplant really is good for patients with kidney
So let's
disease.
talk about the cost of
no.
dialysis.
Yeah.
You know, is it getting cheaper? Because people are really, it's hard to pay for dialysis in this country.
It is.
Are there NGOs that support these treatments? Are there people out there to help people pay? Because there are lots of poor people who need help
Yes,
with this issue of dialysis. Because it's daily, I hear.
So the essentially for your viewers that might not know what dialysis is, we said the kidney removes waste, and when your kidneys are not working, you need to connect this person to a machine to take out the waste. And that's what dialysis is. We essentially move the person's blood to the machine, and usually, typically, a patient will need about 3 of it in a week. Wow. Each session lasts usually about 4 hours. A session of dialysis in Lagos will cost you between 30 to 50,000.
Okay.
You can understand that someone paying 150,000 or maybe 120,000 every week. It's not affordable, and that is just for the cleaning of blood. Remember, the kidney has other things it does. You need to come and take an injection for the blood production. You need to take some tablets for the bone issues. So usually, nobody really can afford this. In other countries, it's essentially free. Government just takes it off. In America, I think it's on Medicare, and UK, it's on the NHS. So if you're on NHS, you just go on dialysis. In Nigeria, the NHIS, I think government's done, and they've tried. The first 6 sessions, if you're on NHIS, is free. But usually, that's 2 weeks.
Yeah.
So no one really can afford it. So that's why we focus on prevention.
And then most times when you hear people getting like kidney transplants, they're always traveling to India. Is it that we can't do it here? Are we doing a good job of it? Why are people, or is it just more expensive here?
Interestingly, there was, we do quite a bit of kidney transplants. Luth used to do, they're working on a transplant program in Luth. Luth does kidney transplants. Those are the general hospitals in Lagos. There are a few hospitals in the east there is one hospital in the east, there's a hospital in the north, general hospital. Then there are several private hospitals in Nigeria that do transplants. And we do quite a bit of transplants in Nigeria. So it's fairly common. We do a few renal transplants. So we can do it. And there's evidence to show that if you do transplant near where you live, you tend to do better.
After hospital.
Yeah. So if you go all the way to India, because your doctor won't look after you from India.
Yeah.
And usually the care is not as good when it's over the phone. You can't keep flying there. So when you are close to the people who got you on this journey, usually it's a lot better for you. So
Okay, so what would you say should be our lifestyle targets? What kind of foods? What kind of, let's say, a proper day's meal? What should
Lifestyle.
who's predisposed to genetically or something?
So like Moria said, I think generally most things are safe, but I think we should cut down on fizzy drinks. You want to reduce salt for kidney disease. One of the things we reduce the amount of salt. I tell my patients is, if the food
stay away
tastes very,
from
very
salt,
good,
pata.
no, you need salt. So, and salt is not just normal, it's not just salt, but things like Maggi contain a lot of salt in it.
Yes.
So we should,
Seasoning.
yes, a lot of the seasonings we use contain a lot of salt. So it's important that you use those things in moderation. I know you have to eat out, but just be cautious of it.
See, this
Eating
salt thing, the other day I was very hungry.
Food no
Yeah.
go sweet.
Extremely. So after you finish eating and the food has now finished, you're like, that's not salt.
Yeah, so it's an aftertaste.
Yeah, because you would have rushed, you're hungry. But after I now finished, I'm like, damn.
The amount of
Salt in this food, but I'd finished it already. So sometimes it's really difficult. But when
Is that something you can
when
use?
you eat really a lot of salt, there's something you can do to flush out the salt.
Drink water.
I think the solution for flushing out anything kidney-wise is just drink a lot of water. And
Water, yeah.
target is to drink 3 liters a day, which is quite a bit of water. Most
If I
people
get that
struggle.
measurement right, which one is 3 liters?
So
It's just a guide even.
it's just a
Okay.
guide. It doesn't have to be. And
Something
then
close.
I remember telling someone to drink 3 liters a day, and he was so bent on getting the target that he wake up in the morning and drink the 3 liters. So we don't want it like that. You want to spread it
Spread
through
across.
the day. Yes. So you want to drink water, 3 liters of water.
Oh, you try to finish the 3 liters.
yeah, just
in the
to say it meets the
morning,
target. So it's not.
Do we have Nigerians who opt to be donors if
Yes.
they pass?
Yes.
Do we have such
Yes.
people?
Who
Because I
donate
know
their
that
bodies
some
We need to-
donate
we need to
body
talk about-
parts. Yeah, when they pass, like they sign it that if I die,
Okay.
if the parts that are working, please give to people who
Organs.
need organs.
Organs.
Thank
Yeah,
you. Organ donors.
so
Do
we don't have a
Culture.
we don't have the legislation in place. We're working on that.
Okay.
So usually you need to have legislation for cadaveric donors before. So when people die, you have that policy in which, because we don't have that, we don't want organ trafficking and all that to become
take
an issue.
advantage.
So we are working on it. I think it's past second reading now. So, but it's one of those things that's been. But presently, we don't do cadaver. Everything is live. We don't do anything cadaveric.
Okay, as head of Federal Medical Center in Ebutimeta, just give us some insights to when people come into the clinic, the kind of stories you hear of people, family, traditions, cultures, religion, that stops people from getting the adequate medical service they require. You know, people come with all sorts of stories. Maybe if we learn from you, we can know how to change and rethink, reorientate people's minds on the perceptions they have of getting proper healthcare.
I think one of the things is people think healthcare is expensive. The other one, they feel you go to a general hospital, you're going to die. And the main reason is because by the time patients come to us, we're at tertiary institutions. So what happens is the person has gone to so many, and when the smaller institutions can't manage, the patient is usually very sick by the time they get to us. But I can tell you for free that I think Federal Medical Center, not because I work there, but I think it's literally the best or one of the best hospitals in Lagos. I think it would be nice if you guys could cover us one of these days. We have an IVF center in the making. We have we have like the most recent dialysis machines. We have a robust renal unit. We're also developing a different type of dialysis that's going to be cheaper for our patients. We have everything. We have an ICU.
I have a friend who's been waiting for the fruit of the womb for years. And recently she had a child. She had two daughters. And I went to visit her. And of course, in my Nigerian thinking, so when did you travel? When did you come back? She's like, I did everything in Nigeria.
Wow.
IVF, the whole works, the children, everything start to finish was done here. She never even traveled abroad. And I was so really impressed with that. She was proud of the fact that everything was done in Nigeria. So just to buttress what you said, that we do have good medical service.
IVF, we have been doing IVF since.
But people do come here for medical tourism, but we pretend as if we don't do that. A lot of Nigerians come over here for medical tourism.
And I've used the Ebutimeta
What do you make of it?
Oh, fantastic. My son has dental, whatever. So his dentist is at the Federal Medical.
Thank
I also
you.
told
And
it.
Nima as well.
I visited a lot. I have a relative working there.
And then
I saw
structurally,
the
infrastructurally, you're doing
Yes.
good
Yes.
as
Yes.
well.
We
Looking
have
better.
247 lights. Oh no, you should come, but we have gone past that.
So I want to get
247 lights.
braces. I should just come to you
Yes,
people.
we would
So we
go.
have
from
sold
you.
Federal Medical Center.
Center, yes.
Are you one of those that just returnees, or have you born, raised, and went to school here in Nigeria, or?
Okay, I was hoping that question won't come up. So I've done a bit of. So I did secondary school at King's College, and then I schooled in Ghana, and then I came back to Nigeria for residency, and then I've done some training abroad, and that also lets me know that it also lets us know that the reason why our doctors can move out easily is because our training is that good and our doctors are that good. And because when I got there and I'm like, it's the same thing.
Yeah.
Just that they have more infrastructure, they can order more tests, they're literally free, but it's the same treatment you get. But
So you're Africa trained. We're proud of you.
Thank
But
you,
like,
thank you.
we just want
She
to
has moved it from Nigeria to Africa.
trained. Yeah, people. So we're proud of that. But I'm happy that
We have good hands,
doctors.
yeah.
We always say it.
Yeah,
The reason why you are taking them is because they are good. If they didn't have a foundation here, you won't take them.
Yes.
But thank you very much for
Thank you,
being here.
thank you so
Dr.
much.
Dan.
Thank you so much.
Danladi. I mean, I like Danladi. You know, we're trying to protect.
Danladi.
I mean, it's born on
The
Sunday.
N is silent, so it's Madu.
Madu, yes.
Somewhere else.
Are you married? Are you married?
I correct
Doctor, are you married?
Yes, I am.
How many kids you have?
None yet.
Oh, but she's like, you can just, you look like a very cute doctor, you know, that would
She wanted to matchmake you.
match you with somebody. But thank God you're married. Praise the
God
Lord.
has seen me.
Regards
Can
to
you
your
feel the
wife.
middle belt energy around
Oh, is
it?
it middle belt?
Oh, yes.
How are you feeling like? See you tomorrow. Bye for now.